I'm here today to tell you why acupuncture and Chinese herbs are so effective in treating fertility. So basically, we break down the menstrual cycle into 4 phases. The first phase begins on the day you get your period, lasts till about cycle day 4. We call that the menstrual phase. In this phase, our main focus is to shed that endometrial lining to create a healthy lining for implantation. About cycle day 5, we switch into the follicular phase, which is at this point when your estrogen is rising in order to build a lining and also trigger an LH surge, so you ovulate. So in Chinese medicine, at this point, we would focus on nourishing yin, which is sort of estrogen, replenishing the blood that's lost, and keeping your body strong and replenished, so it can successfully move into phase 3, which is the ovulatory phase. This is about a few days before ovulation, a few days after. It requires a tremendous amount of energy because your LH is trying to surge to ovulate. In Chinese medicine, we really want to nourish the yin still, which is the estrogen, and really start to focus on nourishing the yang and building some energy so your body can go through this process and implant. After the ovulatory phase is the luteal phase, that's phase 4. And that's when your progesterone is trying to rise. So we really focus on what we call the yang, which is sort of progesterone in Chinese medicine, and focus on moving qi a little bit. Moving qi helps prevent PMS if there's no pregnancy, and nourishing yang keeps the womb warm for an embryo. We typically recommend about 3 months of treatment, partly because it takes about 3 months for the eggs to mature and the follicles to be healthy. Most women, cycle between 25 and 31 days, but that's sort of the reason why we recommend 3 months to kind of get their cycles regular and get them optimal for a baby.